So you know how your face looks is important because it's the first thing that people see when they interact with you. People that appear youthful, energetic, vigorous, tend to do better in all areas of life. When we talk about facial aesthetics, there's a couple things that must be kept in mind. Number one is that you have the basics. So you have to be doing the basic things such as wearing your sunblock, you have to be taking care of your skin, you have to be eating healthy and maintaining a good lifestyle. You should not be smoking because nicotine is terrible for your skin. Next are things that are minimally invasive, and usually most patients by the time they're watching this video have already tried these. Lasers, these are things like mild peels, kind of non-invasive treatments like that. And you see that what it does is it helps your skin texture, but doesn't ultimately really change how you look, right? Then you have the next level, which are things like minimally invasive treatments. That's gonna be your microneedling with radiofrequency, that's Morpheus8, stuff like that. That's gonna be fillers, it's gonna be maybe some threads, things of that nature. And then from there, we have the next step to surgery. Sounds scary, but it is still the gold standard for facial rejuvenation, for facial aesthetics. But what's been nice is that over the last few years, we have gotten really good at making this as minimally invasive as possible. Modern facial aesthetics is applying the concepts of what worked really well in traditional facelifting and taking them to the next level and making them easy, safe, effective, and making them something that a patient can go through easily. Most of my patients are opting for extended deep plane facelifts. Why? It sounds like it's a little bit of a commitment, but what you have to understand is that by doing this surgery, we are able to get a holistic rejuvenation of the entire face and neck. I'm talking about sculpting the jawline. I'm talking about correcting the bands in the neck. I'm talking about correcting the jowls, the nasolabial folds, bringing the cheeks back up to where they belong. All of these things happen at the same time, as well as filling the face with some fat graft. So when it all happens together, organically and naturally, it provides a beautiful result that no amount of minimally invasive or non-invasive treatments can ever even come close to. All of my patients that get facelifts are so happy with their treatment because they recognize the immense amount of value that they get from this, because it really changes how you look for years and decades down the road. With using an extended deep plane technique, we're keeping the tissues more together. You're able to get a much faster recovery, where most of my patients have very little to any bruising in the face. You're able to look much more natural and normal sooner, right? So I'm talking about going out to dinner within a day or a couple days. I'm talking about going back to work within a week to 2 weeks. And on top of that, the results are always gonna be natural, they're gonna be elegant, and they're gonna be beautiful. Most of my patients nowadays are really actually opting for a facelift as opposed to doing something that is gonna be minimally invasive, because at this point, most people have been playing this game long enough to have realized that the minimally invasive stuff ultimately doesn't really give you a lot of value for the money because it's still pretty expensive. Those are my important concepts that I wanted to get across when it comes to facelifting.